Hey mama. Okay, we're going to talk about kinesio tape. What is it? This is a roll of kinesio tape. I have a small test strip here. You can apply it to the skin and it lifts the skin and cues the nerve fibers underneath. Depending on how you put it on, I can kind of activate a muscle, or I can tell a muscle to kind of calm down that's working too much, or I can just manually correct. I know those are big words. Don't worry about it. Just know that you don't want anybody taping your kid. You want somebody that knows what they're doing, because you can essentially make muscles work that shouldn't work, or make muscles that are working over much. You can tell them to work more. So you want somebody that's trained, that knows what they're doing, and not just anybody taping their kid. So also know that unless you've been taught or went to a course or been trained from your therapist, don't just tape your kid. Okay, so I'm going to show you how cool this tape is. Can you see how it has that design of the adhesive? It stretches. So how I put it on, as it relaxes, it kind of tells the muscle, hey, you need to work, which is really cool. Basically, as a therapist, it's like I get to keep my hands on the child, and let's say their foot is turning out and I want to correct that. So now I can, usually I would correct that at the hip. And so it's like I can be at that hip, prompting that hip to kind of come inward, which is really cool. So we wear it for 5 to 7 days. Generally, I'm seeing you once a week, right? If you're working directly one-on-one with me, I'm seeing you most of the time once a week. So I'm going to put it on. Let's say your appointment is on Monday. I'll put it on Monday. You'll leave it on for 5 to 7 days. You're going to take it off 24 hours before our next appointment. So generally that would be, if I see you again the next Monday, Sunday night or Sunday morning or Saturday night would be whichever one you take a bath. You give your child a bath, that's when you would take it off. I will often do a strip up at the shoulder on the right or left side as a test strip. This is only cotton and adhesive. There's no latex in it. I have personally not worked with a child that has had a reaction to it, but I have had another therapist friend have a child that had a reaction to it after wearing it for 5 days. So I really do like to do a test strip, especially if I'm gonna test, be taping their neck, under their chin, or their whole leg if they're rotating, their rotation is coming out. There's so many things we can tape for. Also know that not every child adapts well to it. Not every child responds well to it. So if you're working with me, I will personally tape them 2 or 3 times and kind of troubleshoot, make sure that we're getting the result that we're looking for, and then have you purchase, as a family, purchase the roll of tape. I think a roll of tape maybe costs, this one probably cost $10 or $15, which isn't bad at all, and will last you quite some time if I'm only taping your child with 1 roll. But when I'm taping a whole caseload of kids, it can add up soon. You can get this wet. So when it's on, they can take a bath, pat it dry. Don't rub it, just pat it dry. And do not use the dryer on it. Don't be like, oh, I want this to dry, and think I should get the hair dryer out, because heat activates it. So if you put this on their skin and then you blow dry it with hot air, it's really gonna seal to the skin. And if you take this off and you grip and rip like a Band-Aid, it will take the top layer of skin off. So you have to know how to care for this properly and how to remove it properly. Don't worry, I'm gonna share those with you right now. You can get it wet. We do a test strip and then we'll tape you. So how to remove this? If this is on your skin, I'm gonna put this strip on. If this is on your skin, normally if we're in a session and I can do this face to face with you, I will put it on your finger and pull back as it was cueing your finger to be straight. And then I can fully move my finger. And I know you can't feel this, but it's naturally pulling my finger up. I can move my hand in any way I need to, But the moment I start to kind of relax, it's gonna pull me up, which would be good if your child's tripping over their feet. I can put it on the top of their foot and up their leg in a specific way, and it will cue it to come up. Or if they turn their foot out or turn their foot in, I can put it on their leg in a certain way and cue them to go out or not. So to take it off, you're going to use coconut oil, and you would just slather coconut oil all over this and then wait 10 minutes. A lot of moms tell me that it's better if it's wet to remove it. So I'm just like slathering this thing with coconut oil. Just drops it on the ground. You can slather it up with coconut oil and see how it like just saturate. I mean, you cannot use too much coconut oil. And then let it sit for 10 minutes. And then from that, you're just gonna start to rub. And you can already start to see that it's starting to peel up from the rub. Do you see that? You're literally just rubbing over top of the tape. And it will start to just, it's already started to peel. And then you just keep rubbing, keep rubbing. Again, we're not gonna grip and rip because that will take the top layer of skin off. Just rub back and forth. And if it's not coming off right away, that's okay. Make sure that you've put the coconut oil on for 10 minutes, and then you can take it off. And if it's not coming off right away when you're rubbing over top of it, like this is coming off super easy. It's not been on my skin, so it won't be difficult to remove. But if it's not coming off right away, do another round. After 10 minutes, do another round of coconut oil and then let it really saturate and then rub. If for some reason it really, really isn't coming off, you can pull the skin back and roll it down. That's the only other way. Do not grip at all. Sorry, I dropped it. Don't grip it at all and pull. Just rub over top. Coconut oil, 10 minutes, rub over top. Do it again if you need to. And it should come off just nice, clean, and easy. And usually right away, you're gonna be able to tell if this is working or not. Like immediately after we put it on and they start to move, they should move differently because they've got something on them kind of cueing them to go in a different direction, which is super helpful because then we know right away if this is gonna work or not. Often we'll just leave it on for that week or two, and then then you guys can determine if you want to continue using the tape and purchasing tape for your own. I will post some links so that you know exactly the tape that I have. This is another version of tape that I have. This is like the most gentle version, and I use this on infants and babies with super sensitive skin. But I bought this off of Amazon, not from the vendor. Like I bought this off of Amazon from the TheraBand company, and I must have not paid attention to that and bought this from a different one. And it's not from the company, it's just an offshoot brand, and it doesn't work as well. So you'll want to know the links to know exactly which kind to buy, because I don't want you wasting your money spending money on tape that isn't going to work. The other kind that I have is called dynamic tape, and it's slightly different. But if we're working on your child, if their foot is going in, pointing in or pointing out when they're standing or walking, we're probably going to have dynamic tape, and it almost looks like it's kind of got a design, like almost a tattoo design. It pulls in all directions, whereas that one tape only pulled in one direction. This pulls in all direction, allowing us to get some rotation, which is pretty cool. So I hope this helps. Let me know if you have any questions at all, and we'll chat soon.